Okay guys, so let's discuss the next topic, that is the acute inflammation. So first of all, before starting the acute inflammation in detail, we have to understand the basic principles of acute inflammation. So first of all, why the inflammation is going to occur in your body and when the inflammation is going to occur in your body. So always remember one thing, inflammation basically occur in response to infection. Whenever in your body there is injury or any kind of infection, that will lead to inflammation, and inflammation is the transient and early response whenever there is injury or infection in your body, and it is always characterized by the neutrophil in a tissue, and also it is often associated with edema. So it's mean when there is inflammation, so this inflammation is characterized by the presence of neutrophil in that tissue where the inflammation is going to occur, and oftenly you get the edema in that part of the tissue. Then always remember, acute inflammation occur in rapid onset. It's the second to minutes and short duration response in your body to eliminate the infection or to eliminate the necrotic tissue or dead tissue. Then after that, you guys have to remember, acute inflammation always represents a reaction of innate immunity, and you know that innate immunity basically it is the immediate response, but it has limited specificity. So these are the two important things. Innate immunity, it occurred immediately with the limited specificity. So these are the basic principles you guys can remember according to acute inflammation. Then after that, we have to understand what are the stimuli, like how the inflammation is going to occur, like what are the causes that can lead to inflammation. So if there is infection in your body, that can lead to inflammation. Then if there is a trauma, that trauma will lead to cell injury, and that cell injury can lead to inflammation. Then necrosis, then foreign bodies. So all these are the, you can say, stimulatory signals for inflammation. Whenever in your body there is infection, there is trauma, there is necrosis, or there are foreign bodies, that can lead to inflammation. Then again, what are the mediators of inflammation? So these are the important mediators of acute inflammation. So first of all is the toll-like receptor. So we have to understand this topic very well. First of all, you guys have to remember, like, what are the cells of innate immune system which has this toll-like receptor. So macrophages, and the second cell is dendritic cell. So macrophages and dendritic cell, these are the part of innate immunity, and these are the cells which has the toll-like receptors. You have to remember this. Then after that, how these toll-like receptors are going to be activated, this is another important point. So basically these toll-like receptors are going to be activated by the pathogen associated molecular patterns, PAMP. So basically these toll-like receptors are going to be activated by pathogen associated molecular pattern, and they can also ask from you, like, what are the examples, like what are the examples of these, you can say, pathogen associated molecule pattern. So basically you have to remember, whenever there is any kind of bacteria, let's suppose take an example of gram negative bacteria. Gram negative bacteria, in the outer membrane of gram-negative bacteria, we have the lipopolysaccharide. It is a type of pathogen-associated molecular pattern. So whenever there is a bacteria in our body, on the gram-negative bacteria outer membrane, we have the pathogen-associated molecular pattern, and that pathogen-associated molecular pattern is going to, you can say, react with in our body with the innate immunity cell, like I already explained previously, like in the macrophages, in the dendritic cell, we have the toll-like receptor. So basically you have to remember, on the macrophages we have the CD14 receptor, and it is a co-receptor for toll-like receptor 4. So on the macrophages we have the CD14. So these CD14 basically recognize the lipopolysaccharide or pathogen associated molecular pattern on the outer membrane of gram-negative bacteria. So when the macrophage will recognize this pathogen associated molecular pattern, then you have to remember, after the pathogen associated molecular pattern are recognized by the macrophages will lead to the toll-like receptor activation, and that will result in the upregulation of nuclear factor kappa B. So these are the important points you have to remember. And when in your body upregulation of nuclear factor kappa B will occur, that activate the immune response, that will lead to the production of different kind of immune mediators. So let's take a quick review. First of all, you guys have to remember like what are toll-like receptor. So these are the mediators of acute inflammation. Where these toll-like receptor are present? These toll-like receptor are present on the cells of innate immune system like macrophages and dendritic cell. Then what is the function of these toll-like receptors? So basically these toll-like receptors, you guys have to remember, are activated by the pathogen associated molecular pattern like PAMP. And what is an example? Like I already explained, when the gram-negative bacteria will go in your body, on the surface of gram-negative bacteria, these are the pathogen associated molecular pattern are present. So these pathogen associated molecular pattern are going to attach with macrophages with the help of CD14, or you can say CD14, it is a co-receptor for toll-like receptor 4. So when the macrophage recognize these pathogen associated molecular pattern, then the toll-like receptor will become activated, and when the toll-like receptor will become activated, there is a production of nuclear factor kappa B. It is a nuclear transcription factor that will activate the immune response, and after your immune response is activated, there is a production of multiple immune mediators. So please keep this in mind. Then after that, it's also very important, you guys have to remember, these toll-like receptors are also present on the cells of adaptive immunity, like we have the lymphocytes in the adaptive immunity. So in case of adaptive immunity, you guys have to keep in mind, in adaptive immunity we have the lymphocytes, and on the lymphocytes we also have toll-like receptor. So it's mean these toll-like receptors play an important role in mediating the chronic inflammation also, because lymphocytes are very important in chronic inflammation and neutrophil are important in acute inflammation. So toll-like receptor play an important role in mediating acute and chronic inflammation both. So that's all about the toll-like receptor. Then after that we have the arachidonic acid metabolite. Then again we have to understand from where this arachidonic acid will come. So first of all, we know that the arachidonic acid is released from the phospholipid cell membrane with the help of phospholipase A2, and then after that it acted upon by the cyclooxygenase or lipoxygenase. So cyclooxygenase will help to produce the production of prostaglandins. And like what are the example of prostaglandins that are going to produce with the help of cyclooxygenase? Like we have the PGI2, we have the prostaglandin D2, then we have the prostaglandin E2. So basically these are the, you can say, the prostaglandins which are going to produce with the help of cyclooxygenase. Then also they can ask from you in exam, like what are the prostaglandins that are going to like mediate the vasodilation and increase the vascular permeability in the inflammation. So basically in the inflammation, the increased vascular permeability and vasodilation only occur to because of PGI2, prostaglandin I2, then we have the prostaglandin D2, then we have the prostaglandin E2. So these are the, you can say, the prostaglandins which mediate the vasodilation and increase the vascular permeability. Then also very important, they can ask from you in exam, like in the inflammation we have the pain and fever. So what kind of prostaglandin is going to involve in that? So basically the prostaglandin E2, it is going to mediate the pain and fever in the inflammation. So these are the important point you guys have to remember. Then after that we have to also understand the function of lipoxygenase. Lipoxygenase is going to produce the leukotriene. So like lipoxygenase is going to produce the leukotriene. So what are the example of leukotriene? Like leukotriene B4, we have then leukotriene C4, then leukotriene D4, then we have the leukotriene E4. So these are the examples of leukotrienes. So what is the function of this leukotriene B4? Basically it attract and activate the neutrophil. Then what is the function of leukotriene C4, D4 and E4? So basically these are the, you can say, slow reacting substances of anaphylactic. Anaphylactic, you can say, it is also a kind of hypersensitivity reaction. So these are the inflammatory mediators which are going to react slowly in case of anaphylaxis. And you guys have to remember, these are the mediators which are going to produce the vasoconstriction. These are the mediators which are going to produce the bronchospasm. Then also they increase the vascular permeability. So these are the three important functions which are going to performed by these leukotriene C4, D4 and E4. So if a question comes, what is the mediator that is going to produce vasodilation? So you guys can say PGI2, PGD2 or PGE2. So basically these are the prostaglandins which are going to produce vasodilation. And if they ask question, what are the leukotrienes, what kind of leukotrienes are going to vasoconstrict, like leukotriene C4, D4 or E4. So these are the important point you guys have to remember. Then after that we have the neutrophil. These are also the mediator of inflammation. Then we have the eosinophil. Then we have the antibodies, like the antibodies which are pre-existing in your body. Then also we have the mast cells. Mast cells are also a very important, you can say, mediators of acute inflammation. So first of all, you guys have to remember like where the mast cells are present. Basically mast cells are present throughout our connective tissue. So please keep this in mind. Mast cells are present throughout the connective tissue. Then after that, what are the things that are going to activate the mast cell? Because we say these are the mediator of inflammation. So how these mast cells are activated? So basically the mast cells are activated by the trauma. So these are the important points which you have to write on your book, because here they don't mention or they don't write these things. So trauma is going to activate the mast cell. Then we have the complement protein like C3A, C5A. These are the complement protein that are going to activate the mast cell. Then also we have like the cross linking of cell surface IgE by antigen. So IgE also is going to activate the mast cell. So these are the, you can say, the activation pathways of mast cells. Then after that you guys have to remember when the mast cells are activated, they will release the the histamine granules, which causes the vasodilation of arterioles and also increase the vascular permeability. So when the mast cells are activated by trauma complement protein, these mast cells are going to, you can say, release the histamine granule. Then they will release the granules which will go and produce the vasodilation of arterioles and also increase the vascular permeability. So this is the function of the mast cell. Then also please keep this in mind. There is also a delay response which involves the production of arachidonic acid metabolite, particularly the leukotrienes. So these are the important things about the mast cell. Then we have the basophil. These are also the mediator of acute inflammation. Then we have the complement proteins. Complement proteins are also, you can say, the important mediator of acute inflammation. Then we have the Hagman factor, like factor 12. These are also the important mediators of acute inflammation. So first of all, you guys have to remember a few things about the Hagman factor. So first of all, it is the inactive pro-inflammatory protein produced in the liver. So it is the basic definition of Hagman factor. What is Hagman factor? It is the inactive pro-inflammatory protein which is produced by the liver. So this is the first thing. Then after that, you guys have to remember it is only activated when there is the subendothelial or tissue collagen exposure, because I already mentioned Hagman factor or factor 12, it is the inactive pro-inflammatory protein. And how it is going to be active? It is going to be active when it is exposed to subendothelial or tissue collagen, and in turn it will lead to activation of coagulation and fibrinolytic system, it will lead to activation of complement system, it will lead to activation of kinin system. So these are the important points which you have to remember about the Hagman factor. So if they ask a question from you how the Hagman factor is going to activate it, simply by exposure of subendothelial or tissue collagen. Then in turn Hagman factor is going to activate the how many system, like it is going to activate the coagulation system, it is going to activate the fibrinolytic system, it is going to activate the complement system, then it is going to activate the kinin system. So these are the important point. So if they ask question from you, what is like a kinin system, because this is also not mentioned here in your book. So what is kinin system? Basically kinin is a molecule which is going to cleave the you can say higher molecular weight kininogen into bradykinin. So what is kinin? Kinin, basically you can say it work as enzyme, because it is going to cleave the higher molecular weight kininogen into the bradykinin. So when this bradykinin is produced, it will go and produce the vasodilation and increase the vascular permeability and also produces the pain. So this that is important about the kinin system. Please keep this in mind. Then after that we have to know the inflammasome. Basically, what is inflammasome? These are the cytoplasmic protein complexes. So these are the complexes which are present in the cytoplasm, and these are made up of protein. And what is the function? Basically, these inflammasomes are going to recognize the product of dead cell. These are going to recognize the products of microbial products. These inflammasomes are going to, you can say, uh, recognize the different kind of crystals like uric acid crystal. So when these inflammasomes are going to recognize the dead cell, microbial product and the crystals, they will lead to the activation of interleukin 1 and inflammatory response. So again, let's take a quick review. What is the function of inflammasome? Before studying the function, what is inflammasome? Inflammasome is a complex protein which is present in the cytoplasm. So what is the function? Basically, it recognizes the products of dead cells, microbial product and the crystals, and after the recognition, it lead to activation of interleukin 1 and inflammatory response. So that's all about the inflammasome. Then after that, we have to understand the components of acute inflammation. That is very, very important. So first component is vascular. So what is the meaning of vascular? Basically, in the inflammation, your blood vessels are going to vasodilate, and when your blood vessel is dilated, it will lead to increased blood flow and stasis. And they can ask question from you like how this vasodilation, or you can say how this vasodilation is going to occur. And I already explained to you, during the inflammation there are different kind of mediators like Hagman factor, and then also we have the different kind of like mast cell mediator. These are going to lead to vasodilation. Then after that also there is the increased endothelial permeability. So what is the meaning of endothelial permeability? During the inflammation, the endothelial cells are going to contract, and when the endothelial cells are going to contract, they will open the intraendothelial junction. When they open the intraendothelial junction, it will lead to increased permeability. And then after that we have the second component, that is cellular. So we know that when there is inflammation, there are a lot of like immune cells are going to present at that side. So basically, in the cellular phase, when the neutrophils will come from blood to the injured tissue, it is called the extravasation of leukocytes. So it's mean, let's suppose this is the cell and this is the blood vessel. Normally the immune cells are present in the blood vessel. When this tissue will injured, this tissue when get injured, it will produce the different cytokine, and those cytokines are going to, you can say, are going to give signal to neutrophil, and when these neutrophil get the signal, they will come to that area where the injury is going to occur. So this process is called extravasation of leukocyte, mainly the neutrophil. And from which side the neutrophil come? From blood to the injured tissue, post capillary venules. And after coming from, you can say, blood, these neutrophil or these leukocyte will accumulate in the focus of injury. Let's suppose if here the injury is going, these leukocytes are going to be accumulated here, and after that they will lead to the activation of other immune cells or other leukocyte. So that's all about the second component, that is the cellular. Then after that, they mention here like what is the main function of vascular and cellular component of inflammation. Basically, they bring cells and proteins at the site of injury or infection. Then after that, they mention here leukocyte will come through 4 steps, like as I already mentioned. Normally the neutrophils are present in the blood vessel. So neutrophils are going to come to this injured tissue by 4 steps. First one is margination, second one is rolling, third one is adhesion, and fourth one is transmigration, and the fifth one is migration. So these are the different steps which lead to neutrophil extravasation. So please, you guys have to remember these steps. We will study these steps in detail in the next page. Then after that, what are the outcomes of inflammation? And this is also very, very important. The outcomes of inflammation you guys have to remember for your exam. So first of all, the outcome of inflammation is resolution and healing, and that is going to occur with the help of interleukin 10 and tumor growth factor beta. So they will ask from you in exam, what are the leukotrienes or what are the mediators that are going to resolve and heal the inflammation. The interleukin 10, basically it is the anti-inflammatory. Then tumor growth factor beta, it is also the anti-inflammatory because it is going to inhibit the inflammation. So that's why they mention here it help in resolution and healing. Then after that, the acute inflammation can become chronic inflammation. The acute inflammation can persist for many days, for many months, for many weeks. So they can ask from you in exam what kind of interleukin is going to helping in the inflammation to persist. So that is the interleukin 8. So interleukin 8 is going to help in the persistent of acute inflammation. Then after that, acute inflammation, we know that during the inflammation sometime abscess can occur. So acute inflammation walled by the fibrosis, it is called abscess. Then after that, acute inflammation, if it continues, if it persists for like 4 week, 8 week, 10 week, 4 months, 6 months, it will become chronic. And always remember one thing, chronic inflammation is always characterized by the macrophage and other antigen presenting cell that lead to the activation of CD4 plus T helper cell. And after that, acute inflammation, you can also get the scarring. So basically these are the important outcomes. Then they mention here macrophages predominate in the late stages of acute inflammation, peak around 2 to 3 days after the onset, and influence outcome by secreting cytokines. So what is the meaning of this line? Basically, when the inflammation is going to occur, in the early response of acute inflammation, you will see the neutrophil, but after the 2-3 days or 4 days, you will see the macrophages at the site of acute inflammation, and they are going to influence the outcome by secreting different kind of cytokines. Like when the macrophage will come, they are going to produce the different kind of cytokine. So that's all about the acute inflammation.